Hello and welcome. My name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine physician. I specialize in injuries of the shoulder, elbow, and knee. And welcome to the Whiteboard series. Today we're going to talk a little bit about lateral and medial epicondylitis, also known as tennis elbow and golfer's elbow. And I would just want to go over what exactly it is and the appropriate way to use a counterforce brace or the type of brace that you would need for any of those tendinitises. So basically, tennis elbow and golfer's elbow occurs from repetitive use of the wrist or the elbow. And if you're looking at an elbow right here, the bony anatomy, the lateral side, which is the outside area here, this is where the common extensors that lift the wrist insert right here at the bone. So the muscles come up and insert right here to the lateral epicondyle. The medial side, which is the inside of the elbow, the flexors, which allow you to flex the wrist, insert right here at the medial bone. So what happens is with repetitive forceful activities, you irritate both of those insertion sites. And depending on your swing and what type of sport you're playing is going to determine whether or not you're going to have a medial epicondylitis on the inside or a lateral epicondylitis on the outside. And it's usually due to repetitive forceful flexing or repetitive forceful extension. So I've seen medial epicondylitis or golfer's elbow in tennis players as well, usually when they're going through with a forehand. You'll see more tennis elbow when they're going through with a backhand. So that's using more extensors. When they're going their forehand, it's using more flexors. Golfers typically in their swing, when they're coming through, they're flexing their wrists sometimes, and that irritates this inside aspect of the elbow. When that does become irritated, you get an inflammation. If it's a long period of time, if it's chronic, sometimes you can even get partial tears of this tendon. Many people have partial tears of the tendon, and 9 times out of 10, this can be treated conservatively with conservative measures and non-operative measures. If you fail conservative measures, then definitely I would highly recommend that you be evaluated by an orthopedic specialist, preferably somebody that specializes in shoulder, elbows, and knees and has an experience of dealing with this type of problem. The good news is that this is a very common problem, and most general orthopedists are familiar with treating this type of pathology.